So in a knee replacement, what you do is shave off the bit of the femur and put the femoral component in. And I want a tibia. Can I have a tibia? Wow! Magic tibia appears. So the same thing happens, and we take a bit of tibia out and put a rod inside, and hence you have got a knee joint. So this is your artificial knee joint, which has got a femoral component, a tibial component, and a plastic in the middle. And here goes.
Just one warning. He makes it sound very easy. Don't try this at home.
Okay. Okay. And here we go. The engine is there. So,
but essentially, so that is a fairly tedious procedure. Lots of geometry involved. Lots of reproducing the biomechanics of your body so that you walk with your foot pointing forward and walk in an effective, stable manner up and down stairs and get back to the quality of life that you've been pining for. Now, we will be showing you a video about what happens after a knee replacement, but just before that, you surely want to know the risk and complications that are involved. So what do you tell them before
so
operation?
There are a number of complications, one which we all mention, but we try really hard not to overwhelm the patients with 1,001 complications. The complications which I primarily mention are infection. Infection normally occurs from the skin bug you have, hence what Mr. Jacobs said about not shaving your leg before surgery and using a chlorhexidine bath before surgery, and also factors like no cuts and wounds should be there in the leg before you go for surgery. The second complication is nerve damage. Now with knee replacement, there are lots of sensitive nerves around the knee, and it's a usual not a complaint but a usual question. Do you think at 6 weeks majority of the patients do ask that the scar area feels a bit numb? What do you tell them when they ask you that question?
So we often sacrifice a little twiglet of a nerve that comes in front of your knee replacement scar, and that can compromise the sensation on the outer aspect of the scar, or the lateral aspect of the scar as we call it. Now if that happens, it tends to take about anything between 6 weeks to 3 months to return. You may have a permanent patch of numbness, but it's not something that you're going to miss dramatically. We often advise that you can have some cream to massage the scar to desensitize the scar.
Yeah. And the stiffness is a major problem with knee replacement, and hence it is absolutely vital that you get good physiotherapy before to rehab your knee and afterwards to decrease the stiffness, because you get about probably 6 weeks to 3 months to get the stiffness out of the way. So I always tell patients that it is a race between your scar tissues and your muscles acting. So the muscles have to strengthen, mobilize your knee, and the scar tissues are trying to stiffen your knee. The other significant complications are you can have fractures during a knee replacement. If you have got osteoporosis, one has to be careful, which most surgeons are, but that is a risk factor associated with a knee replacement. The generalized complications are heart or lung problems or deep vein thrombosis, which can lead on to, if it leads on to pulmonary embolism, can cause death. It's a very small percentage, but still it is there. We give anticoagulants to prevent that. That are the major complications I discuss. Do you discuss about revision and periprosthetic fractures?
I do, but we'll save it for another day.
Sure.
I don't want to end on a very gloomy note. The knee replacement is indeed a successful procedure. It's slightly more painful than the hip replacement, so treat it as a different beast altogether. And we will talk to you in our next video about what happens after knee replacement and the rehabilitation procedure so that you can get the best out of it. Thank you for tuning with us.
And remember, your health is your responsibility. See you next time.
Bye-bye.